Hello, and
Hello.
and I'm very pleased to be introducing Vicky Fox. You are a Vicky, aren't you?
Yeah.
You're a Vicky. Vicky Fox, who is a yoga teacher, but she does have, I suppose you specialise in cancer, or one could read that as people with chronic conditions as well in many respects. So I'm really interested in yoga. I've only done a little bit myself. It's one of those things I keep thinking I really need to get on and do it because I know it's really, really good for you. So welcome, Vicky. And if you could just tell everyone a little bit about you, that'd be wonderful.
Yeah, so hi. Thank you for having me here. So I'm Vicky Fox, and I've been teaching yoga since 2008. I was always really interested in the therapeutic side of yoga. So how yoga can help with injuries, how yoga can support, and I was also always really interested in how I always felt better after a yoga class than when I started the yoga class. I always left feeling better, and that was fabulous. And in about 2013, I retrained with a wonderful teacher from America who came over, and she taught this training that was yoga for survivors, which is, I think, translates better in America than it does here. But it was yoga looking at when you're impacted by cancer, how yoga can be beneficial. And so I did this training for a year, and then I started teaching classes, and it was one of the best things I ever did.
And do you do, I was going to say ordinary yoga, or are all your classes focused on those with cancer?
Yeah, no, I teach open level classes as well. So I have a mixture, probably it's almost about half, I would say, but years have gone on, I teach more and more classes. I mean, to begin with, there just weren't as many opportunities to be able to teach yoga for cancer classes. And I first started teaching in a cancer centre in Battersea called Paul's Cancer Support Centre, a wonderful centre, but it had a shared space. And so the space that we used for yoga would also be used for teas or coffee mornings or drinks things. So you'd occasionally go into the class and I'd pick up crisps off the carpet, before we did our yoga. And I always really wanted to try to get the yoga for cancer into a yoga studio. And so I approached Try Yoga, who are a big yoga studio in London. And I said to the owner, would it be possible to try and sort of get a class in here? And somebody had offered to sponsor me, or they worked for a company that had a charitable trust. And they said, we could sponsor you. So I was discussing with Try Yoga what their room rate would be, and we were sort of going through this negotiation. And then the charity they voted for something else. So I didn't get the money. So I had to go back to Try Yoga and say, I'm really sorry, I don't actually have the money to do the room anymore. And Jonathan Satin, who owns Try Yoga, said, you know what, you can have the room for free if you're happy to give your time for free. So I suddenly got this beautiful room in a yoga studio, which was easy for people to get to from the cancer centre as well, because it was just across the bridge. And that was great. So I started this free class there, and that's how it kind of grew really from there. And people were able to come in and have beautiful props, and I didn't have to pick up crisps from the carpet anymore. I mean, I still work for Paul's, and they're a wonderful, and they're just a fabulous cancer charity, but it's just occasionally with a shared space, you don't always know what you're turning up to.
And so with I suppose one of the nice things is that you're going to sort of in a way treat or manage your cancer, but you're not in a hospital setting, which must be a really important thing as well.
Yeah, I think so, because I think it's quite nice for people to get out of the hospital setting and come into somewhere that isn't a medical setting. And also because I think the important thing about yoga, which is that when you are diagnosed with cancer, you become a patient and you go into hospital and things are sort of being done to you. The difference with yoga is this is you now taking back some control. So you come to a yoga class, and hopefully through my guidance, you might find some tools that are useful to you with whatever it is you're going through in that particular moment. So maybe that particular moment you're working through some scar tissue on one side of the body, or you have limited range of motion, you need some support on how to get back range of motion in a safe way. Or maybe you're not being able to sleep at night because your mind is so busy and you need a bit of support on how to maybe quieten the mind a little bit, and things that might help you then go back to sleep. So you're coming into yoga, you're no longer a patient. You're not a patient when you come to yoga. You're a student. And actually, I always think my students are my best teachers. So you're a student and a teacher, because I've learned so much from everybody that's come into the room. But now you are starting to be a co-crafter of your well-being. You know, you are taking back some control and going, okay, this works for me, or that's really useful. I like that and I don't like that. And with yoga, there isn't a one size fits all. So there's not a right, this is what you have to do, and there's only one way to do it. There's many ways to do something. And there are many techniques. You know, some things might really work for someone, because some of us are very visual, but some of us aren't so visual. So if you give someone a visualization, I'm really rubbish at visualizing things. So actually, when someone does a visualization, I think I get a bit lost, and I'm like, oh, I can't find myself on this beach you're on, relaxing. I'm a bit lost. And now I've got sand in my, you know, bikini bottoms or whatever. So, you know, we're all different. So you just sort of give little different techniques and tools, and hopefully people will find something that resonates with them and works for them. And that's what I hear back from people who come to my class. You know, oh, I tried your breathing technique when I was waiting for my scan, or I was waiting to see my oncologist, or I was having the scan and I was feeling a bit anxious, and I started doing that breathing thing you do, and it worked, you know. So
oh, that's nice. So, and I suppose two things: you're not defined, first of all, you're not defined as a patient, and then you're not defined as that cancer patient, which I think is really important, because you're still you're still a person in your own right, which I think is really important. So when do people do they come to you at any stage, you know?
I really wanted the classes to be open to anybody at any stage. So if you've heard the words "you have cancer," this class is open to you. I also wanted it to be open to carers and supporters, because I was very aware that for a lot of people, they might have a partner or a carer or a sibling that is going through it with them, but yet they're not part of it. They're not having, the treatment is not happening to them. It's happening to their, you know. So I wanted the class to maybe be somewhere they could come and something they could come and do together, because it's really stressful for that partner as well, or the parent, or, you know, carer or child going through that. So I wanted it to be open to them, and I really wanted it to be open at any stage, because, you know, I think years ago there was definitely an idea, you know, going through chemo, well, you should go home and rest, you know, take it easy. One of the big side effects is fatigue. But we now know that although you maybe can't build muscle mass, you wouldn't be looking at building muscle mass while you're going through chemo. You can maintain muscle mass, which is really important for fatigue. Sounds really counterintuitive, but if you are fatigued, exercising is one of the best things you can do, because the more you can keep muscle mass, the easier simple jobs can be. And for a lot of people, they want to be able to still, you know, do their own shopping, or pick up their kids from school, or walk up the flight of stairs to get into their flat or their house, you know. So you want to keep muscle strength. So, and I wanted this to be available for people, whether you were just diagnosed, you were going through treatment, or you were even maybe many years post-treatment. Maybe you've been in remission for a long time, because I think you still have, when you've been, once you've been diagnosed with cancer, that thing is always there. That even if you're in remission, any bump, any lump, any strange pain you have, you automatically think, oh my gosh, is this cancer coming back? You know, whereas maybe if you've never had cancer, you might not think that. You might, oh, I just bashed my hand, that's why my hand's aching. So I really want those classes to be available for anybody who's ever been impacted by cancer.
And I think it's great, because I think carers people just don't, you know, especially with chronic conditions, people just forget quite often there's a carer behind that person, supporting them along the way, whether it be physical or mental.
Yeah.
And, you know, and to be able to share something as well, or even just to come along and understand how you can help somebody who has got cancer, the things that they can do that might be able to alleviate, like you said about the breathing. And I know we're going to go through some practical exercises as well. So that would be great. So I'm just having a little look at the things that we said. So what are the benefits? And I'm sure that we could spend the whole hour talking about the benefits of of yoga, but I know we're going to look at both the mental side of it and the physical side, which is great.
Yeah. So I mean, that is the thing with yoga, is it addresses both. I mean, firstly, I'd say the most important thing about yoga is the breathing. So, and it's what makes yoga different maybe from other types of exercises. You could do very similar exercises, and I do sort of steal exercise from all over the place. I might go to Pilates class and think, oh, that's so good, I might just put that in my yoga class because that's a great way of opening up the chest, or I think that would be really beneficial. Or I go to an exercise class, I think, oh, that's great, I like that little exercise they did, that's gonna help. So I do sort of, pull things from all over the place, but the breathing is what makes it key, because the breathing is what brings you into the present moment. And why is it even important to be in the present moment? But the present moment gives you a break from your mind. And for most of us, that's our challenge. Our challenge is we have this wonderful thing, our mind, which is fabulous. And it can be incredibly creative, but it can also be very limiting and also not very truthful. So often our mind tells us things that aren't necessarily the truth. And when we worry, we're projecting fearfully into an imaginary future. It doesn't even exist. So we don't know what's going to happen in the future, but yet we'll be worrying about what we think might happen in the future. And we can use up a lot of energy, wasted thinking about something that may never happen. So the breathing is really key. So everything we do is we always start the class with some breathing exercises. And then really, it's like a vinyasa class. You're moving with your breath the whole way through. And a lot of the movements we do are dynamic because the body needs to be moved. The body is designed to be moved. So on a physical level, moving your body, you can actually sort of create a sort of pumping action in your body when you're moving it, because you close and open joints. That helps to flush fluid back through the body. So the lymphatic system is key for that, and the blood also, blood and lymph moving together. The lymphatic system doesn't have a heart, so it is reliant on us moving to get the fluid back towards the heart, which is the direction we want it to go in. You also, there's risk of losing bone density. Treatment we know affects fast growing cells. Well, we have fast growing cells in our bones. So if those fast growing cells affected, you can end up with osteopenia or osteoporosis, which is loss of bone density. So we want to use things in yoga that are going to help to strengthen the bones as well, but also moving in a very safe way. So you're not doing anything that is going to put someone at a risk of fracture. So I play safe, but I also try to challenge people. So there's that sort of physical side going on there. And then scar tissue, we need to release out any areas, radiotherapy can create scarring in the body, and so can surgery. And then sometimes just moving one bit of the body more than the other, which we do when we injure ourselves. So if you injure one side, you maybe hold one side still and you overuse another side of your body, and that builds up tissue as well. So trying to release that scar tissue so the body can flow freely and the body becomes at ease. And I guess that's the physical side of it, but it's always going to be with the breath. So I do a lot of dynamic stuff. And so we'll be, inhaling, and then we'll be exhaling, and we're moving the arms or the legs or the body with that breath.
Whenever I've been to those, you hear lots of people just snorting through their nose, and think,
no, I don't encourage big. No, we're definitely not making big heart. I know what you mean. They're doing an dry breath where they breathe very noisily through their nose. It's totally unnecessary. And actually, I think it creates quite a lot of restriction at the back of the throat, which is what we don't want. No, I'm quite relaxed in our yoga class because not everybody, congestion is one of the side effects of treatment. So not everybody can breathe in and out through their nose. So they might be needing to use the mouth to breathe. So there are a lot of things where there might be rules in other yoga classes that don't apply to this class, because if you need to drink water as you're moving through class, some people might be chewing gum just to maybe keep the mouth a bit hydrated. There's all kinds of things that people could be doing in a yoga for cancer class that you might not normally allow in a regular class. Phones, for example, I had the other day, someone said, I'm sorry, but I'm really waiting for a phone call from my oncologist, but I really wanted to come to class, and I know you're not allowed phones in class. And I said, I think on this one you can have your phone. Go on, get your phone in with you. You need to go straight out. So we adapt so that the class is accessible to anybody. And I want it to be really inclusive, so that if you've been diagnosed with cancer, you can come to this class at whatever stage you are.
And it's nice because everybody understands that that people have probably something in common that you don't have to discuss, but you understand why you're there.
Yeah.
As opposed to having to say, oh, well, I've got this wrong with me or that wrong with me. And I understand how the breath is so important, because if you're doing something physical, your mind can still be thinking about other things. But if you're having to concentrate on the breathing, it then gets tricky. Then you've got breathing and arms. So I'm sure it does centralize you, doesn't it?
Yeah, and also you can't breathe in for the past or the future. So anytime you're consciously breathing, which most of the time our breathing just happens. So we're not actually consciously breathing because it's just happening. It's unconscious.
Oh.
But when we actually start to focus on our breathing and you're actually like, oh, I'm breathing in. Oh yeah, I'm breathing in. And oh, and now I'm breathing out. You're very much in the moment. You know, you can't be off somewhere else if you're actually consciously breathing. And I always say to people, when you notice you're not breathing, that's because your mind's gone off somewhere else. You know, you've suddenly wandered off to your shopping list or your to-do list or to worry about something. So it's just it's like a constant process of coming back again and again and again to the breathing, you know, so that you're trying to bring yourself into the present moment. So for the 60 minutes you're in a class, you're trying to get as much of a break from, you know, normal life and you know, put yourself. Also, the great thing with breathing is when you're breathing in and out, and it's conscious and it's smooth and it's fluid, you start to calm your nervous system, because the breath is the quickest way to affect the nervous system. And as we know, when we're scared and anxious and fearful, we're more in that fight or flight side of our nervous system. So it means when you're in fight or flight, your heart rate increases and your blood pressure increases, and lots of vital functioning just either decreases or is almost non-existent. So your digestion, you're not digesting fully when you're in fight or flight. Your immune system's not working fully. That's quite important. Reproductive system's not working fully. You don't need to be digesting a meal if you're needing to sort of get away from a situation or there's a danger. So our body shuts a lot of these things down. And what we want to do, because we're looking at trying to repair the body, is to switch it dial it out of that fight or flight and bring it into more rest and digest mode, which is the parasympathetic side of the nervous system. And this sort of calming side of the nervous system is where the body then goes, okay, I'm not in danger anymore. I can go back and repair. The immune system starts functioning fully, digestive system starts functioning fully, and then blood pressure lowers and heart rate lowers. And that's where we want to try to be. So that's why we're also using the breath to calm and soothe the nervous system, because then that gives someone a better chance to help their body sort of start to nourish and nurture itself.
So going back, so it's funny, we've spoken about the breath. So the breath seems to help both mentally and physically.
Yeah.
And then the physical things that I think you said were, for example, when you make people expand to open up, you're helping the scar tissue.
Yeah, so I mean, I always think yoga's about putting yourself in these strange shapes as an excuse to be able to breathe into them. So sort of opening up the chest and then breathing into the chest and then getting movement. We often do a lot of small movements for joints and things like that, because obviously joint pain can be one of the side effects of treatment. So, you know, circling ankles and wrists and getting elbows moving and then moving shoulders and things like that, you know, just starting to get range of motion so that the body can move easily and it doesn't get stuck, because we just don't want there to be scar tissue, because it's going to act a bit like a gate. It's going to stop movement through the body and movement of fluids and things like that. So yeah, so just freeing up scar tissue. Sometimes people get cording, which is sort of thrombose lymphatic vessels in the arm, but also in the chest and also in the back area. And these are literally like cords. So someone can't extend their arm because there's like a cord there, which I was always told it need to be released by a physiotherapist. But during lockdown, because people were coming into my classes saying, I can't see a physiotherapist, you know, I haven't been able to leave my house. I'm getting texts all the time telling me I'm vulnerable and I need to stay at home and I can't get to see anyone. So can you help with this cording? How can you release it? And then what was brilliant with Zoom is then someone else would jump on and say, well, actually, sorry, Vicky, but you know, that exercise you got us doing the other week, that helped really release my cording. So I'm like, great. Okay. I was learning from my students, you see, that's fabulous. So that was child's pose. Okay. With the arms out in front and you wiggled your fingers further forward and wow, that's really interesting. So people were jumping in on, you know, chats to share, I think, more than they were in a normal studio. There was something fabulous about Zoom in some ways that allowed people to maybe, you know, just share knowledge. And maybe in a yoga class, normally you come up to the teacher and you might talk quietly to her if you want to tell them, or her or him. You would come up and say, oh, by the way, sorry, I've got something going on today. What can you help? Can you help with that? Whereas in a Zoom thing, it's very public, isn't it? You know, and so students were all sharing. That's fantastic to have that sort of all together, co-crafting.
Yeah. So throughout COVID, when we're under lockdown, so you were communicating with your students.
Yeah, so the minute it looked like we were going into lockdown, I thought, right, I need to somehow be in a position where I can still be able to teach, because I didn't want all these wonderful people that I teach to suddenly not have a class to come to, because I know how important the community is. So I just took exactly the same classes times that I taught in studio, and I put them on Zoom. And then a few months, or about a month into it, Try Yoga then also put a class on Zoom as well. So that enabled me, they've got a better marketing power than I have, to be able to get more people to be aware. And I just emailed the few email addresses. I'm rubbish at doing my my mailing lists and things like that, but I just emailed people that I had and said, look, I've got these classes. And people then found me, you know, but they went through my website and found the classes. So yeah, I was able to teach literally from the beginning of lockdown, the whole way through. I taught these classes, and they became really important. And I was also able to link up with, so I work with a physiotherapist, and she came on to, we did one class specifically about scarring and things. So she came on to give her advice, and I gave some yoga advice. So I tried to use the platform as much as I could to help and support people with whatever they were coming in with. And I did a whole lot of collection of small videos as well that I used to put on my website, because people would come in saying, oh, I'm stuck with this, or I can't do this, can you help? You know, because they weren't able to get into hospital and see people. So it was an interesting learning curve for me. And that's actually how I developed the book, because you know, through lockdown and realizing people never come in and say, I have breast cancer, how can you help? Or I have bowel cancer, how can you help? What they come in with is the side effects for treatment, because there is very little support, and sometimes non-existent support, for people and their side effects. And in fact, what I hear from a lot of people is they're so grateful that they've had treatment and they've sort of come out the other side, that they feel like they just have to accept that they have these side effects, that they don't think there's any support for them, because it never seems to be offered. And I think the yoga can give you that support. So people were coming in saying, I've got lymphedema, or I've got scar tissue, or I've got cording, or peripheral neuropathy, which is where the long nerves into the hands and feet get damaged by treatment, and it causes numbing, or sometimes pain in the hands, or they lose connection because they're not able to use the hands in the same way. So I was just doing all these little videos. So, okay, I'll give you something for peripheral neuropathy, and then I'd put them up, and then I'd say, right, how did that go? You know, what did you all think? And you'd say, oh, well, that bit was good, but that wasn't so good. And, you know, we all learned together. I learned so much more, I think, during lockdown than I had in maybe all the years previously teaching in a class.
I mean, I'm shocked that there is, and you're right, because it's the same with any chronic conditions, that it's not the condition that people want to talk about. They want to talk about the symptoms, or how you live and manage day to day with what you have left, or what you're dealing with. And I can see that with a physical class, you kind of go in there, and I'm sure people sort of scuttle to their space, don't they? And then you're just looking at the teacher. It's not open for necessary discussion. And I can see how the Zoom allowed that. But one of the biggest things, isn't it, is that you don't know the symptom that you've got, if that's normal, or if it's safe, I presume, to try an exercise, because I'm sure lots of people are worried, oh, am I gonna pull something or damage it? And that must be where it must be so reassuring, being able to see you doing these things and being able to discuss it openly.
Yeah, I mean, I think for things like, so, you know, if you've had lymph nodes removed, or you've had radiotherapy to, groin or armpit area, you're at lifelong risk of lymphedema, which is a chronic swelling in the arm, where when the lymph node's removed, it's sort of, there's a dead end. So your lymphatic system normally filters through a lymph node, but it doesn't, it gets kind of stuck there. And if the lymphatic system gets compromised, you can get lymphedema. There's no rhyme or reason why some people get lymphedema and some people don't. So you could have full lymph node clearance and never get lymphedema, and have one lymph node removed and get lymphedema. So they're still learning a lot about why people get lymphedema, but it can then put you at fear that if you go back to a regular yoga class, are you going to get lymphedema? And so at least with these classes, you know, everything's been designed so that you are not being put at risk of getting lymphedema. So I don't do massive big weight bearing poses on the arms, but I will get us strengthening our arms by doing things where we're not weight bearing, And I will also do things that pump. You can use the arms like a natural pump. I mean, if you just did this for a moment, you feel your muscles working, but I've got a sort of natural pumping action. The muscle contracts and then releases and contracts and releases. And this helps pump fluid. So what I hear from people is that the classes, sometimes when people leave, they feel much lighter in their arms. They don't feel as full or as swollen, or maybe later on they get that release. So this is a safe space for you to come to, where everything's been taken into consideration, and I'm just not going to put anybody in any danger, and I'm not going to do any poses that might restrict somebody. So I don't do an awful lot of lying on our tummy poses, because I have people that come to the classes with stomas. So I'm not going to put, I don't want them not being able to participate in something that everyone else can do. So I just find ways of adapting it so that it is a safe space for everybody.
In fact, that was one of the questions that I was thinking is, do people stand or sit, or can they do you do both sorts of options depending on what the issues people may be having to cope with?
Yeah, so I mean, we have chairs in the studio. So today I started, actually we started a class lying down, but then we came to sit. So some people take the chair option, so they can do all the things sitting in the chair. And then I have the chair around for balance, because obviously, if you have a weakening of the bones, or if you have balance problems, so if you've got peripheral neuropathy in your feet, it means that you lose a bit of connection to the feet. It can be very easy to trip, because imagine if you can't really feel your feet, you don't know if you quite pick them up enough, you can catch them on things. And so people can be at risk of tripping or falling, and we obviously want to make it safe. So the chairs will be there for people to use as support, or walls are fabulous props. We love walls. But yeah, so there's lots of ways of adapting it. So if someone can't lie down, they can do the beginning part of the class on the chair. Most people I've come across are able to do standing poses in the class. And if your needs can't be met in a group situation, then I would highly recommend speaking to me about doing a one-to-one, because obviously mostly what I do teach is group classes.
Yeah, absolutely. So we've looked at the physical and the mental, and they all just interconnect, don't they? Definitely.
Oh, completely.
And I'd have thought that a lot of the mental side is the fact just coming there, meeting other people, all of those things.
Yeah, I mean, I think that's when I feel the most proud of my classes, is when I see people, because we do free teas after class, and so people can stay, and I'll stay for a bit and then I leave, people chatting. It's seeing people connecting and seeing people sharing, and that's when I feel proud. I'm like, oh, that's great, like-minded people coming and just supporting each other and sharing with each other. It's really nice to see.
And I think because it can be very alienating having cancer, and how you communicate with people. So, if you're having to always tell your story, or if you can just be with people who are similar, and you can just dive straight into the symptoms that you might want to discuss without all the other emotional stuff behind it, makes it much easier.
I think so also, that, people with cancer are quite often caretaking other people, because they're looking after other people and maybe keeping on a brave face for them. They also might have people around them that can't discuss the word cancer, or don't know how to respond to them. So maybe might avoid them or avoid talking about it. Whereas you're suddenly in a space where cancer is, I wouldn't say I talk about cancer the whole way through the class, but it will be mentioned, and we'll mention side effects, and we'll talk about it quite openly in class. Then you're with other people that you don't have to maybe caretake or worry about what you say, that it might upset them because they're your partner or your loved one or your child. Yeah. You can actually talk quite openly with people who have a bit of an understanding, and we're all unique. So one person's diagnosis will not be the same as somebody, even if on paper they look like they have an identical diagnosis, they'll be different, because we're all different, and we come to these things with our own life experiences and our own viewpoint. Some of us are more open to things, or some of us naturally have a more glass half full rather than half empty, so we'll all have a different way of looking at it and experiencing it, because we're unique. But you can still share and support and understand what somebody else might be going through.
Absolutely. And also, there's so much stigma behind the word cancer, isn't there, for so many reasons. And I think the more that we can start talking about it in an open way, And I suppose, you know, the positivity is so much now, that whereas beforehand cancer was that, oh my God, it's that sentence, that's it. And it's not there. It is becoming increasingly, for many types of cancer, thank goodness, a chronic condition that you can manage, and you know, you can live a long and fulfilled life. And that's really important to know as well.
Yeah, I mean, more people are now living longer with the side effects of treatment for cancer. So we are living longer post-treatment, but we're living with side effects. So, you know, and it depends on what kind of medication you're taking. Maybe you're taking a medication that's for hormones to block or stop the hormones that will have its list of side effects. So yeah, we are living longer with it, but that's why I think understanding that there is some support there for you for your side effects is really important. That there are these classes, and I train teachers, so I'm training more and more teachers to be out there having an understanding of what the side effects are and how they show up in your classes, and how to look after people that come to you with those side effects, and how you might be able to help them, because I do hear quite regularly how things have helped people.
And I think also, once, you know, if you have cancer, and, you know, where the NHS is brilliant because it's acute, they jump in, you know, they sort you out, and then you go home, and then what? Nothing. And the fact that if there's something to move forward, you know, going to a class like yours, whether it be online, obviously we've got to talk about your book in a minute, but there, it isn't suddenly, you know, you've got everybody's full attention and then you're just dropped, you know.
Yeah.
And I think that's very hard to cope with as well, from being the center of everybody's attention to nobody.
Yeah, I mean, I think it can be a very isolating and very sort of scary moment for people. This is the moment you've been wanting for ages, your treatment to end. But up until then, your life has been scheduled, you know, appointments, having to be somewhere at a certain time and looked after by a big team of people. And then suddenly that stops. And that can be really quite frightening, because you don't feel like you want to travel too far. You feel like you still want to stay quite close to hospitals and home. And you don't feel like you can just go and have that holiday you've been wanting to have for a really long time, because you feel nervous. And also life has changed, you know, you go back to a new norm. It's not the norm it was, because, you know, life has changed, and that can be also really challenging. And maybe then you go back to work and suddenly your work well, here's your workload that you've been missing, you know, and so suddenly you go back to life and people go, oh, right, they've forgotten about you now. And your friends think, well, you're all done, you know, and yeah, so I think having other people that you can, a shared community that's there for you, is, I think, really important. We all survive better. We're all better in a community. We're all better with support, aren't we?
Yeah. And for a lot of people, things I've heard is that for cancer, it can be, because it does change you so much, the amount of loss of confidence that it can give you, and being able to start going back out to see people and all of those things is must be great.
Yeah, and you know, some of the side effects are really obvious. So, you know, if you've lost hair, that might be a really obvious side effect. And it depends how much you attach to some of these things, how much they upset you or bother you. So if you don't feel so attached to your hair, then maybe it's not a big deal. Maybe you you know, you quite enjoy beautiful scarves or wigs, or, you know, but for somebody else that might be the most awful thing ever to have happened, just to be losing their hair. And then there are other side effects which are maybe not so obvious. Maybe losing a breast isn't so obvious to other people, but to you it's obviously a huge thing. And then some of these things are internal. Maybe you've had parts of your body removed that aren't obvious to anybody on the outside. So there's big, huge physical changes as well. Confidence in your physical body, and also sometimes confidence with people where they weren't even aware they had cancer. They went for a routine mammogram and found out they had cancer. So sometimes there's that confidence of sort of loss in believing your body, or, you know, like, wow, that's really interesting. I didn't know I had cancer, and yet I had cancer, and my body didn't tell me that. And, you know, so there can be all kinds of sort of a big sort of spectrum of lack of confidence, not just, yes, in your ability to be the person you were, maybe the confident, carefree person you were before. And there can be grief. You know, I put a chapter in my book about grief, because you've lost a little bit of, you grieve the life you were going to have, that carefree life where you didn't even think about it. Now it's always, it's always with you. It's always there at the back of the mind, and that's completely normal.
Absolutely. So simple things that we were going to sort of run through, and if you can sort of give some examples of what would help. We mentioned it before about balance, because balance is a big problem for lots of people without even realizing it.
Yeah. So balance, I think balance is going to be helped with a couple of things. Firstly, opening up your feet, which is what a lot of people don't do. So our feet have lots of little bones in them, like our hands do. Our feet have lots of little bones. So our feet should move a little bit like our hands, but as we know, we put them in shoes and they work as one unit. So our feet become a bit stiff and not very malleable. So one thing you can do is try to release out your feet. And I always say, if you can get hold of your foot and slide your fingers in between your toes, which is normally the most challenging thing for people to do, get the fingers in between the toes, and then use your fingers to try and open up and close your toes. So you can stretch and open your fingers, which open up your toes, and then rock your toes around and circle your toes and get movement in the feet. So the more malleable your feet are, the more then you're connected to your feet. And especially if you have something like peripheral neuropathy, where you've got numbing, tingling in your feet, you don't really feel connected. So strengthening opening up the feet and then strengthening them. So weirdly, I think one of the simplest things that I love, which people can do easily, is anything that is getting your calves moving. So any little calf raises, that wasn't a very good angle, was it? It's going to be really good. So little calf raises, you can do these seated, so you can do them even now sitting in your chair, just little calf raises, because the muscles from your feet are coming from your leg. So if you can strengthen out your calf muscles, that's going to help strengthen your feet. And our calf muscles are also like a little heart, pumping blood and fluid back up the leg. So it's really important for us. And then for balance, the other thing is being mindful. So again, it kind of comes back to the breathing, because I don't know about you, but the few times when I do trip and I've fallen have been when I'm mindless. I'm like, I haven't even noticed something on the floor because I'm in a hurry and I'm like, looking around and my mind's somewhere else. And you're more likely to fall when you're not very present and in the moment. So again, it's back to that breathing, that if you're breathing and, taking your time, you're more aware of things around you. You're less likely to catch your feet or not see that child's toy on the floor or whatever it might be that you might trip over. So building back strength. And with balance, I often say to people, you can start to practice standing on one leg every time you put the kettle on. Put the kettle on to make your cup of tea, stand on one leg for a moment, lift the other foot up, and then change sides. And then every time you brush your teeth, when you're brushing, 1 minute, stand on one leg for 1 minute, then stand on the other leg for the other minute while you brush your teeth, and just start to put little balancing poses in your life so that you can start to, because balance is a skill that you can learn and relearn. So if you keep putting little bits of balance into your day, you'll start to get better at balancing. And also that's great for bone density, which is really important, because we know that hip fractures or put people in hospital, and you also lose a lot of people lose independence if they end up with a hip fracture. So we want to sort of avoid people falling, and if they do fall, have them more flexible to catch themselves, but also strengthen the bones. So if you stand on one leg, you've got double your body weight going down through one leg. And we know that bone responds to any force applied to it. So if you're applying force to a bone, it's going to build more bone strength. So it's kind of a win-win, starting to balance, starting to be mindful, release your feet, strengthen muscles maybe in the lower leg to help support the feet. And that should all help with your balance.
And I think the biggest problem, isn't it, is especially for people when they get older, is falling.
Yeah.
It's a real problem. And Michael Mosley, he's done that short, I don't know if you've heard Michael Mosley's short series of the little things you can do, incorporate every day, and one of them is balancing. It's really, and I think he probably gives you examples of doing your teeth, because it's so important.
Yeah,
definitely. Another thing that we've already discussed, but not particularly, is the post-surgery, is the scar tissue, which we know is a problem. I'm not sure how much it's discussed. I don't think whether people actually discuss it when you leave hospital as to what you can do, how you can massage it, and so presumably you do a lot of things.
Yeah, so yeah, I don't think it is. I don't think it is commonly discussed. And I think you know, if you are lucky enough to get to see a physiotherapist, which not everyone is, you know, after treatment, then maybe a physiotherapist might talk you through some of this. But you know, within our bodies, we have connective tissue that literally connects the body, as it sort of says, and it runs the whole way through the body. So even, you know, if one area of the body gets tight, it can have a sort of knock-on effect somewhere else in the body. So you can have a collapsed arch in your foot, and you can maybe feel it in the neck, because that's how connected the body is. And our muscles and connective tissue should sort of glide like this past each other. So when you're, you know, moving your body, things should glide. But what happens when we get scar tissue is that doesn't happen. You actually might end up a bit more like moving, like you're moving through sandpaper, like that. And the other thing that scar tissue does is it can start to adhere to other tissues. It's quite sticky. The body's very clever, especially around scarring. You know, it'll lay down fibers in lots of different directions, like if you were putting a elastoplast in lots of different angles to really make that joint. So the area becomes super tight. The problem with that is, instead of, you know, it being smooth, it now gets a little bit kind of stuck and sticky. So we do want to keep the area moving. And so I do a lot of repetition. So if I'm doing a sort of side bend, again, you may have limited range of motion. You might not be able to straighten your arm. You might have to keep the elbow bent, but we might just be breathing and trying to open up the side. We might even add on a bit of massage. So you might start to massage your rib cage as you sort of breathe and move into one side, and start to sort of find where it might feel a little bit tight, just gently massaging and trying to release that like that. And keeping the body moving is really important. Again, it comes back to that thing that if you've got tight areas of the body, they act like a gate, and they're stopping movement of fluid, which is so important. So if you are at risk of something like lymphedema, you do want to really you don't want to get too stuck. And I think actually what people are given is, they are given generally some exercise to do when they leave hospital, which will definitely keep the movement going. But massage and physiotherapy isn't always offered to people. And I think sometimes that's what we do need, is a bit more maybe manual manipulation of scar tissue from the outside with, yeah, a very good physiotherapist, or someone that is, there are people that are trained to release sort of scar tissue area. But again, you know, I'm not sure how much people are aware of that those people are there, or if they're ever even offered to them. It might be something people have to look out for privately, you know, to find that.
But a lot of it is about knowing about what you should be doing, because when you leave hospital, yes, you're given loads of leaflets, but quite often you're getting over the trauma of, you know, the surgery you might have had or what's happened to you. You can't take everything in you, and also you're very relieved because you think, gosh, that's it, I'm out, you know, hopefully. And it's afterwards, isn't it? It's not the first couple of weeks. It's okay, moving now forward. You might have to be doing these exercises for a long time. It's not just a question of just doing them there and then if you remember to do them, because we're all awful at doing certain exercises that we don't like, especially if they're not, you know, they hurt to start with, that you need to keep practicing, and you may not see an immediate benefit from it. I think that's quite hard.
Yes. And, you know, I think, I mean, I had a student who came to my class who for a long time had a lot of pain around the rib cage area, which she just accepted, because she said, I'm just so grateful that I'm here. And I just took that, of course, I'm going to have rib pain because I've, you know, had all this surgery. And she eventually did manage to see a scar tissue therapist who she said was fabulous and released the scar tissue. She said, I'm not in any pain anymore. I just accepted that was it. And I'm just really grateful I'm here. I'll just put up with the pain. She said, but I hadn't realized that there was an option not to be in that pain. And once she had the, you know, tissue, once she had the massage, it had gone, you know. So I think yoga, you know, can work with alongside physio and massage as well. And even, you know, lymphatic drainage is fabulous as well. That's very gentle. So that's more, we do some of these sort of stroking movements sometimes in class, just encouraging. So lymphatic vessels are very close to the surface. So you can just encourage those by just gently stroking. And that can be quite nice as well, because, yeah, being loving and kind to yourself is not a bad thing either.
No, absolutely. What else do we say we're going to talk about? How to alleviate some of the common side effects, symptoms from treatments. Well, we've discussed quite a few along the way.
We have discussed quite a few. Yeah, so I'd say fatigue is very common. And again, I think the thing is with fatigue, we do want to try and move the body. There's definitely more and more evidence nowadays that moving the body actually helps reduce fatigue. Sounds very counterintuitive, but it does. I think for things like nausea is obviously another side effect, and I often recommend anything that can elevate your legs. So lying down with your legs like over a sofa or your legs up a wall, really simple pose that can be very sort of calming. Again, it's more the sort of calming of the nervous system that I think helps with things like nausea and just calming everything down so the body can go about doing what it was doing. Again, it's sort of taking it out of fight or flight, out of the sympathetic side of the nervous system, back into that parasympathetic side of the nervous system. So any poses that are restorative, which means you're basically lying over yoga props and you're not actually stretching, you're just in a lovely held pose. It might be a pose that slightly opens the chest, but again, you're held by cushions, and then you're just breathing and you're calming the nervous system. So that they can be really useful for things like nausea. And then, yeah, we talked about the joints. So joint pain is a big side effect. Hot flushes, we haven't really talked about, but, you know, people are put into often a medical menopause, and the side effects of a medical menopause can be much more extreme because they're faster than regular menopause. So people come in often with hot flushes. So we do a sort of breathing technique, which is quite cooling. It's like you make a little straw shape with your mouth and you breathe in through the mouth like this. And then you close the mouth and then you breathe out through the nose. And if you keep repeating that, you'll feel your mouth actually starts to get cooler. So and then you start to visualize that cooling traveling down to your throat. And every time you breathe out, warmth coming out through the nose. So, you know, there are lots of techniques that you can do that don't necessarily, because yoga is about breathing and actually mudras, we haven't even talked about mudras, but these are hand movements that can be really beneficial, guiding energy and conserving energy. So it doesn't have to be on days when you don't feel like you have the energy to move. You could be doing some breathing techniques which are calming or cooling. If you're finding, oh, I'm sitting on a bus and I've got a big hot flush and I need to take off all my clothes, maybe you just sit and you try the breathing technique, which is also just cooling and calming your nervous system. So even if you don't have hot flushes, you can try it to see how it feels, you know, to just be calming. So yeah, I mean, the book I've done has an A to Z of side effects. So it literally goes, well, it doesn't literally go. I try to sort of adapt, but there's not every single letter of the alphabet, but pretty much from A to Z, you know, yoga poses that might be able to help, or yoga techniques, breathing, movement that can help with some of the side effects.
Well, should we talk about your book? Because I'm really keen to. So first of all, we've got an offer on for the books, but it's only, I think we've probably got a couple of weeks to go, so you need to get in. I think we've had lots of people really interested in it, but tell us about what made you write a book. I think you might have said earlier, but really,
yeah, well, I've been writing a book for ages because the only books that really were on the market were more aimed at teachers. So they seem to be more technical. And I thought it'd be really nice to have a book that wasn't aimed at teachers, and it wasn't aimed at maybe the yoga community, but it was actually aimed at people that had cancer, and just gave them some little tips, some things that I've learned over the years that I think could be beneficial. And so I started writing a book a long time ago, but it wasn't the A to Z of side effects. It was just a general yoga for cancer book. And with COVID, when we were, you know, on Zoom, it then became more apparent that what people really were coming with were these side effects. So they weren't coming in just needing general advice. They were coming in, you know, not being able to sleep, having hot flushes, joint pain, lymphedema, scar tissue, wanting to build back strength, but wanting to build back strength in a way that wasn't depleting them because they were really low on energy, and all of these things. And so that sort of then made me realize that that's what the book needed to be, was addressing the side effects, because that's what I saw people didn't have a lot of care for. You know, they had their treatment, they were then released from hospital, and there wasn't any future care for them. So hopefully the book will be addressing that. And I've got videos that go with the book as well. So if it's harder to follow, you know, from that, I've got some free videos that support the book, and they're on my website.
I mean, and it's always, easier, isn't it, if you could see somebody, because you might be able to read it and you might see a diagram, but if you could see someone doing it, it's much quicker, isn't it, to interpret it, I think.
Yeah, and we had some interesting moments with my publisher as well, Georgina, who's fantastic, where I wrote the book exactly how I speak in a class. So when I wrote how to do a pose, I just did it because I've been teaching, the yoga for cancer class I've been teaching for over 9 years now. So I've got a lot of experience of teaching it and then looking up and seeing, oh, no one's doing what I just said. So, okay, I haven't explained that very well. Let me re-explain that. So I thought I had it down to a T then. And then occasionally Georgina, when she was going through the book, she tried to do every single pose just as I explained it. And occasionally she'd call me up and say, I don't understand how you can do this pose. You've just explained, do this and this and this, and then how can you possibly do that? So then I'm like, okay, I need to rethink. Maybe it isn't written as clearly as I thought it was. And sort of looking at how to do these poses. So hopefully they will make sense to everybody.
And I think, but it's like a bit like cooking books, isn't it? You think, oh, it sounds simple, and you think, but how do they get from A to E? You missed out something that's really obvious because you might assume people know. And I suppose for you, you're thinking people are watching you, so it is important, isn't it?
Yeah, and in yoga, the transitioning as you move around is also really important. So if you do have risk of, if you have osteoporosis and you have risk of fractures, maybe in the spine, you want to be very careful when you're moving around because you don't want to be having big things that really flex, the spine. You want to try and keep the spine neutral because our spine is at its strongest when it's in neutral. It's really important when you're coming from the floor up to stand that you move in a way that doesn't put your spine in any risk of fracturing. So again, it's like remembering all those transitions and not to put too many wordy information in, but so putting somewhere, these are how you transition, and then that carries the whole way through the book, and learn these principles, and then that will keep you safe with whatever you do in the book.
So we had a couple of, I was just going to say, there was one other thing which we were talking about, relaxation, but yoga, do people, I think before we started this, you were saying how people fall asleep in your classes. I would take that as a compliment.
Oh yes, no, absolutely. And I was saying to you earlier that, sometimes people say to me, oh my gosh, yes, I fell asleep in your relaxation at the end. And I say, well, you know what that means, don't you? And they go, what? I say, well, you're just tired. Because, sometimes we are, and someone gives you a chance to, and I talk a lot when we're relaxing because I want to try and keep you in either the body or just very in the moment rather than your mind wandering off. Because I know when I first started doing yoga and they put us in relaxation at the end, I would use that time to plan what I was doing later. So I'd be lying there in Shavasana going, right, so I need to return that email, make that phone call, so I wasn't actually taking advantage of this time. So I try and, guide people. So maybe a body scan where you guide them from their toes up the body, various body parts, just to keep them sort of, in that moment so that they're not maybe wandering off somewhere else. But yeah, relaxation is a great way to finish a class, to have a moment.
And you're right, because we spend our whole life rushing on to the next thing, isn't it? And it's, that's nice. I don't know why to do it.
We once read that we're often leapfrogging over the present moment because we're so busy trying to progress. We're trying to get to the next stage that we're actually not really in this moment very much.
Definitely. We're on our blooming phones.
Yes, the phones don't help either. That is the advantage of yoga. Your phones have to stay outside.
Yeah, that's good. So I've got a couple of questions.
Yeah, great.
So first question is, what do you need to be careful of hurting? And I think what they're saying, what do you have to be, is there anything that you have to probably safeguard?
Yeah, so I'd say definitely you want to be safeguarding your spine. So I do play very safe. I don't do anything that really rounds the back. And if it is rounding the spine, because we do want to move our spine in all directions, but I do it where it's very supported and you're definitely not hanging anywhere with a rounded spine. So I think you really want to be mindful of that. Sometimes people need to be mindful of twisting, that they're trying to get lots of length before they twist so that they're not damaging, again, the spine. That they're the things that get bad press, forward folds and twisting in relation to osteoporosis, but I think they're fine if they're done safely. I guess, encouraging people to not push into pain. So everything should be pain-free. Sometimes you get pulling sensations, you know, the scar tissue we know can have a little tugging sensation sometimes, and that's fine, but pain is not fine. So it may depend on what you have, you know, where you've had surgery as to what you need to be looking after. But I'd say generally, no pain, no pain is a rule you want to take in with you to yoga.
No pain, no gain. Not that one.
No, not that one. This is no pain, no pain.
I've just had a breast removed and keen to get back to exercising. I've never done yoga before. Are there any moves in a normal yoga class I need to be careful of?
So yeah, you need to be probably about 6 weeks post-surgery with all its surgical incisions healed to be going back into a normal yoga class. If there is risk of lymphedema, you want to be really mindful with your weight bearing. So a lot of yoga classes have downward dog as one of their poses, which is a fabulous pose. I love downward dog, but it's a big weight bearing pose. There's a lot of weight going down through your arms, and you might be made to hold it for quite a long period of time. You also might be made to hold a plank, which is also a very big weight bearing pose for your upper body. You need to build back strength slowly to get back to those places. So plank, do it with your knees down, come in and out of the pose, so you're not holding it for a long period of time. So come out of the pose, come back into it, come out of the pose. So you're just slowly starting to build back that strength, so you're not overstressing the arms and putting that body, you know, if your body's having to work harder and it's a bit restricted, then you could develop lymphedema. So you just want to be mindful of that.
Okay. That was it. So I feel inspired to go and have a yoga class now.
Well, you can join one of my classes. They're free. So all you need to do is tryyoga.co.uk and you can join a free class. I'd love to see you. You can come and see what I do. Join any of my free classes.
No, that's brilliant. Well, thank you very much, Vicky. And I'm sure that everyone will be, you know, really interested to hear what you've said and to give them the confidence to go out and do it and to realise it is an option for everybody.
It is.
And presumably that you have both men and women in your classes.
Yeah, I get men. I don't get as many men. So if anybody can help inspire any men to come to yoga, but no, I have, yeah, it's open to both men and women.
Excellent. Thank you. Well, thank you very much, and look out for Vicky's book.
Brilliant. Thank you.
Thank you. Bye, everyone. Bye.